So today we'll do the first part of inflammation. I'm going to start with specific gravity, which is how the density of something compares to the density of water. That's pretty much all specific gravity is. It's usually for comparing fluids. And then we'll get into transitate and exudate in relation to that. So the transitate is a temporary fluid. It's transient, and then your exudate is full of proteins. So proteins are pretty dense, so that's going to have a higher specific gravity than a transitate, which has fewer proteins. But both of them have a higher specific gravity than water because it's greater than 1. So the transitate is 1.01 and then the exudate is 1.02. It sounds like a small difference, but usually the small differences are what throws your body out of whack, so that's why we have the focus on it. So essentially, when you get edema, which is like swelling for whatever reason, they can take the fluid from that and figure out whether it's a transitate or exudate. If it's a transitate, it usually means there's like a heart failure or something like that where your body isn't taking the fluid into your blood flow like it should. And then if it's an exudate, it usually means there's inflammation of some sort. So if you have an infection or autoimmune disease, then you probably have exudate. So the two main components of inflammation are going to be the cellular and then the venous. So in the vein level, that's when you're gonna see the fluids, like where they're going. If they're leaving your veins and being in the extracellular space, that's gonna be your inflammation, your edema. The cellular level, you're going to see a lot of leukocytes and probably your neutrophils, your phagocytes, stuff that you would expect to see in inflammation. Hydrostatic pressure and plasma oncotic pressure. The hydrostatic pressure is going to be the water being pushed out of your blood flow. So like it's going to be greater around your capillaries and less around like the bigger veins and such. And then your plasma oncotic pressure is going to be pulling your excess fluid into your veins and circulatory system. So that's usually what helps regulate and prevent you from having edema or other issues. Triggers of inflammation, that can be infection, it can be autoimmune. There's a couple more that I can't remember right now. The features of inflammation, there's 4 main ones, and then if they get really bad, you have your 5th one. So that's going to be your heat, redness, swelling, and pain, which they like to use their Latin version. So heat is calor. If you know Spanish, it's the same. Redness is rubor. So I can't help, you just gotta know Latin, I guess. Swelling is tumor. If you can think about like cancer tumors or something that swell up that shouldn't. And then dolor is pain, also the same as Spanish. There's a lot of Latin roots in the Romance languages, so I like that kind of crossover. And then all of them together, or if any of them get to a point where they impede your daily function, it's called functio laesa. So like the failure of a function, like it won't work. Like if you know that a cell that lyses dies, like L-Y-S-E, then laesa, L-A-E-S-A, is like the same thing. It kind of like kills the function. Those are cardinal features. Acute and chronic inflammation. Generally, acute is recent, it's hot, it's more serious. Chronic is ongoing. It's serious, but it's not usually like ER type level. It's usually been, if someone's talked to their doctor, it's managed in its own way, or they have a plan for it. I need more details on that actually. And then I think I covered most of these, but I can go back and get some more details for part 2, because now I kind of know what I'm missing a little bit. And yeah, I'll give one example of a disease from inflammation would be lupus, because it's an autoimmune one and it's kind of chronic. I gotta get more details on these.